Hello, everybody. This is Gary. Today is January 4th, 2022. It is 9:46 a.m. in the morning, Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. As far as my symptoms go, my anxiety levels are pretty high. Um, my depression is pretty strong. My delusions and paranoia are pretty strong. I went out for a walk and I felt like people were following me when they really weren't following me. Um, my hallucinations are pretty intense right now. My auditory hallucinations. I don't have visual hallucinations ever. Today I had my first group meeting with what's called a DBT therapy or dialectic behavior therapy. That group starts at 2:30 today. Um, it's not yet 10 a.m. where I am right now. Um, the group is designed to help people in the group cope with stressful situations and their symptoms and their circumstances, both internally and externally. I have the habit of going to the psychiatric emergency room a lot, and DBT therapy or dialectic behavior therapy is supposed to help me cope better with stress and my own symptoms, even if I'm feeling suicidal, without going to the psychiatric emergency unit. Going to the psychiatric emergency unit is never pleasant. It's always overcrowded, chaotic, noisy, overflowing with people. Sometimes things get violent. Sometimes people are forced down into a gurney or a bed. They're strapped down and forced medications through a needle. That certainly happened to me when I was inpatient in the hospital. I've been forced down and injected with medication in the past. That's happened to me numerous times. Um, so obviously, no one would like to take a trip to the psychiatric emergency room. No matter what hospital you go to, it's always going to be chaotic and overcrowded, especially with the COVID-19 pandemic going on, under stress, filled with anxiety. It's very, I'm just saying that nobody likes to go to the psychiatric emergency room, and it's very unpleasant. But for me, I actually haven't gone to the psychiatric emergency room since October 30th of last year. So it's been October, November, just over 2 months since I went to the psychiatric unit. I'm probably going to the psychiatric emergency room a lot less often, simply because I have a therapist and I've been seeing her, a psychotherapist, a talk therapist, every 2 weeks, instead of just seeing the psychiatrist. My next appointment with my psychiatrist isn't going to be until February 3rd or 4th of this year. Um, we have continued my Klonopin and Zyprexa when I need it for anxiety and psychosis. I did take 5 milligrams of Zyprexa this morning, along with half a milligram of Klonopin to help reduce my anxiety. Right now, my psychiatrist is withdrawing me from. Yeah, Greg, I'm doing better than I was a couple of months ago. I think I'm more stable because I'm seeing a psychotherapist. Um, but my psychiatrist is withdrawing me from Neurontin, which is also known as gabapentin, and it's causing me a lot of physical pain. My nerves feel like they're on fire. But if this is what Neurontin does, then it's better to get off it now and go through the physical pain with it now than worry about going off of it later. I didn't realize how addictive Neurontin can be. Um, but apparently it's very addictive. I was taking 600 milligrams 3 times a day. We've reduced it over time to 300 milligrams 3 times a day, and we're going to reduce it even more. This is causing me a great deal of physical pain in my arms, my legs, my muscles, my joints. Um, the psychiatrist I have now isn't even the one who prescribed the Neurontin. Um, and he wasn't exactly sure why I was taking it. It's supposed to be for anxiety, but most people don't take Neurontin for anxiety. They take it for neurological pain, migraine headaches, I think, things like that. But that's not why I was taking Neurontin. I was taking it for anxiety, and it really wasn't doing anything. I mean, the fact that I need Klonopin means that the Neurontin wasn't helping with the anxiety. Um, I also saw my general practitioner. I am pre-diabetic, which is not uncommon with Seroquel. Seroquel can lead to diabetes. I take 600 milligrams of Seroquel nightly, and I am overweight for my height. I'm 220 pounds, and I'm only 5'9", and I have high cholesterol. I've quit smoking, but my doctor wants me to go on a healthier diet to reduce my blood sugar without taking medication and reduce my cholesterol without any medication. I'm already on a long list of medication, and when my general practitioner doesn't want me taking any more medication, my blood pressure is normal, and I am taking blood pressure medication for that. But that's just another reason my doctor doesn't want to add any more medications to my list, because I take 2 medications for high blood pressure. I take um, 2 medications for my stomach. I have a history of stomach bleeding, ulcers, indigestion, um, irritated colon, um, irritable bowel syndrome, I guess they call it, and a few other digestive problems. I have a problem with constipation, so I take medication for that. I have a list of medical medications that I take and a list of psychiatric medications, and my general practitioner doesn't want me taking any more pills, um, because I'm on like 7 or 8 different medications daily. So we're going to try to see if we can reduce my cholesterol through diet, reduce my weight through diet and exercise. I just went out for a walk. I just came back. It's a little weird trying to exercise outside when there's snow and ice in the ground. I live in Rochester, New York. It's winter. It's January, and it did snow recently, and there's ice outside, and it's about 20 degrees outside. But I do have to exercise. I want to reduce my cholesterol, reduce my weight, reduce my hyperglycemia, which is high blood sugar. Um, so I'm just generally trying to improve my physical health. Like I said, it's not uncommon for Seroquel to cause diabetes and obesity. It makes you eat more because you never feel satiated when you're eating. You never feel full, so you keep eating, and you have to make a conscious effort to control what you're eating and how much you're eating. Um, but I've been on Seroquel for so long that um, it makes no sense to try to change my medications. So I do get out in the winter. I just went out today a little while ago for a walk for about 45 minutes. Um, and so my physical health needs definite improvement. But taking the Seroquel really isn't an option. We did reduce the Seroquel from 1,000 milligrams a night to 600 milligrams a night. That's still a pretty high dose of Seroquel. Most people don't take 600 milligrams of Seroquel daily. Um, but my agitation can be so intense that I require that much uh, Seroquel to control my hallucinations, my mood swings, and my delusions. Um, like I said, I have a group today. I have to take the bus out to the clinic. It's the first day of the group, so I don't know who's in the group. I haven't met anyone in the group yet. And I'm seeing my psychotherapist tomorrow, and I'm seeing my psychiatrist in February.